Hello, everybody. I'd like to extend a warm welcome to all of you for this meeting for aged care residents and families in Victoria. My name's Kyle Olsen. I work for an organisation called OPAN, which is the Older Persons Advocacy Network, and I'll be facilitating today's meeting. Thank you all for joining us. Before we begin, I'd like to acknowledge and pay my respects to the Gadigal people of the Eora Nation. They're the traditional owners of the land on which I'm currently located. But we also acknowledge that the majority of you today will be watching from lands of other nations, including the Kulin Nation. So we pay respects to all elders, past, present, and emerging. Right now, Victoria finds itself in its fourth lockdown since the pandemic began. Now, we understand that this is a very, very trying, stressful, and of course, very emotional time for all of you. So the purpose of today's meeting is to provide all aged care residents in Victoria and their families a forum where we can provide you with reliable, now that's the most important thing, up-to-date information on the situation as it stands today. Now, we wanted to give you the opportunity to ask questions and importantly, get answers to those questions about the current COVID outbreak. We received a lot of pre-submitted questions when you registered, so thank you so much for that. And those questions will be answered just a little bit later in this meeting. Speaking to you today and answering those very questions, we have from the Australian Government Department of Health, Professor Michael Kidd, who's the Acting Chief Medical Officer. Also from the Department of Health, we have Lisa Peterson. Lisa is the Assistant Secretary for the Aged Care Vaccine Task Force. She's working with the Vaccine Task Force on a Commonwealth level. Also joining us, we have Gerard Mansour, who's the Commissioner for Senior Victorians, Craig Gear, who is the CEO of OPAN, the Older Persons Advocacy Network. And we also have Deborah Nichols, who is the Manager of Advocacy at Elder Rights Advocacy, which is also known as ERA. Just so you know, ERA is the Victorian state branch of OPAN, and it's ERA who will be developing direct advocacy support to older people and their families in Victoria. Look, very quickly, before we get into it, I just need to cover some housekeeping. We are videoing today's meeting for those people who are unable to attend, and we will be posting it to our webpage in the coming days, so it can be watched back at a later date. Now, you'll receive a link in to the video in a follow-up email. Now, if you are watching this live and you would like to ask a question to one of our speakers, simply click on the Q&A button, which is located in the bottom of the screen, and type your question in there. Now, if you've already pre-submitted your question, you don't need to resend it. I already have it and I'm ready to ask it. Now, due to the large amount of people watching, and once again, thank you all so much for joining us, the questions that you send through live will be sent through to me and I'll ask them for you. Now, if you have any technical issues, once again, use the Q&A button and our support people will be able to help. They're named Tech Support OPAN and Chat Support OPAN. Right, let's get underway. I think it's really important that you know who OPAN and ERA, our Victorian state branch, it's important that you know that they're independent bodies. And what I mean by that is that we're not affiliated in any way to the government or, of course, the Department of Health, the Aged Care Quality and Safety Commission, or any aged care facility. What OPAN and ERA do is provide free and confidential aged care help, support, and information. So today, as an example, we're facilitating this meeting to give you an opportunity to be heard. So you can ask your questions and, of course, get answers to those questions. Now, if an answer is not available today, we will follow it up with the government and report back to you with their response. Now, the government's responses to these questions will be listed on our webpage, and the webpage address is opan.org.au. Can we just reinforce that for the purpose of today's meeting, we obviously won't be able to answer specific information about individual care homes and, of course, about individual residents' private situations. However, both OPAN and ERA are here to provide you with help and support moving forward should you need it. So you may want to jot this number down, as after the meeting, you'll be able to speak to one of ERA's Victorian-based advocates on the phone. Now, the number you need is 1800 700 600. 1800 700 600. That phone line is manned from 8 a.m. to 8 p.m. And just as a reminder, if you do think of a question at any time when you're listening to the speakers, please put it in the Q&A, click on the Q&A button at the bottom of the screen and just type it in there. Right, first, I'd like to hand over to Craig Gear, the CEO of OPAN. Craig, can you start off by explaining how today's meeting came about, and then perhaps talk a little bit about the rights that exist for residents and their families?
Yeah, thanks, Kyle. Look, thanks everyone for tuning in today at such short notice, but we thought it was important to put a forum on like this to get information to older people, to people in residential aged care, to aged care workers as well, and to families and their representatives. It is a bit of a confusing time for people, and there's a lot of things in the media and understandably a lot of frustration out there. But this is about being able to bring your questions forward. If we can't answer them today, we will take them up to the government and take them to the ministers as well. And we've promised and we've informed the ministers that we'll be doing that. We had a meeting like this a number of times during the previous waves in Melbourne, and we found that they are a good opportunity for people to say, I've been asking this question, or we've got some common questions, and when we're not quite getting the level of information that we need, and to be able to bring that forward, and also to provide you information about what's going on, to bring people like the department and the Commission of Senior Victorians to you as well, but also to let you know that there are supports out there that are free, confidential and independent. We did a meeting like this on Monday night with families from our care and Maidstone. And for me, reflecting on that meeting and reflecting on where we were in the previous waves, I have to say I felt extremely comfortable that lessons from previous waves have been learned, and that this aged care provider in particular, and then also talking to the CEO of Blue Cross, are putting everything in place to make sure older people are protected, that their well-being is supported during this time, given that some people are having to isolate in rooms, and they're doing everything they can to get vaccines into people as quickly as possible. So I do want to really thank our care and the work that they're doing to also keep communication channels open to older people and their families. And to thank all the staff, the InReach staff, the first responders, everyone else that's out there that is wrapping around to support that facility, but also to support Blue Cross. And fingers crossed that things have been got on top of here, and that we can move forward as quickly as possible out of these restrictions. We've talked about before that older people have been the ones that have been most strongly impacted by the COVID outbreak and the restrictions. So there is a thing called the Charter of Aged Care Rights. The Charter of Rights is really important, and it still stands during this time. So if people want to know more about the Charter and what their rights are during this time, please contact us on 1800 700 600 or go to our website and have a look at what the rights are there. So for that, thank you to my colleagues from the department and to Jared Mansour for coming onto this so quickly. And thank you for Elder Rights Advocacy for all that you're doing here as well. Thank you.
Thanks, Craig. Deborah, can you please explain to everyone the services that OPAN and ERA can provide that may be of help to the residents and the families and carers watching today?
Thank you, Kyle. Look, yes, I will be repeating, I think, what Kyle and Craig have already said to some extent. Our services are free, confidential and independent, and I just want to stress that independence is critical again, because it means we can be biased towards a positive outcome for the older person. So we work at their direction and represent their perceived interests, and are very interested and focused on their voice being heard. So the sorts of things that we can provide are information on what's happening, so that a person is enabled to self-advocate, or we can provide direct advocacy, and that will be advocacy that is directed by the older person or their representative. So we work in a way that you are most comfortable with. And that could be that we contact the provider and speak to them on your behalf. It could be that we organise a care plan meeting and become involved in further care planning and communications and consultation with the provider.
Thank you, Deb. Michael, I just wanted to say thank you for joining us today. We understand it's a very, very busy time for you, but we really do appreciate you coming here today to personally answer people's questions and concerns.
Thanks, Kyle, and thank you for the opportunity to come and meet with all of you today. Thank you to OPAN for your leadership in this initiative and in all the work that you do in advocating so effectively for older people in Australia. I just wanted to say that, like most of the people online, I am the son of someone who's living in a residential aged care facility in Melbourne. My much loved mum is in a facility in Melbourne, and so I do understand many of the stresses which you are going through as Victoria is in this fourth lockdown, and the worries about the health and well-being of your loved one and the concerns to make sure that your loved one is being cared for and cared for well. And I just want to say a huge thank you to the people who are running the facility where my mum is based for the care that they're providing to her, but also to the people running facilities right across Melbourne at this time. Kyle, happy to answer any questions that people have today.
Appreciate that, Michael, and thank you for sharing that. I'll now hand over to Jared Mansour, who is the Commissioner for Senior Victorians. Welcome, Jared. Thank you for joining us.
Thanks very much, Kyle. Look, I'm very pleased to be here today. I'd also like to start by acknowledging the traditional owners, the many different lands that we're meeting on today. My role essentially is to report to our state government here in Victoria. So I'm very pleased to be here today, Kyle, to make sure that the state government's kept informed about the range of feelings and issues that are raised by families and residents today.
Thank you, Jared. Thank you for all that you're doing as well. I'd like to also introduce you to Lisa Peterson, who is working with the Vaccine Task Force at the Commonwealth level. Welcome, Lisa.
Thanks very much, Kyle, and hi, everybody. Great to be here today. Really appreciate the opportunity to have the conversation with you. So my role, as Kyle explained, is to we're organising the vaccine rollout that's happening across residential aged care facilities across Australia. So really happy to talk a little bit about what that means for Victoria. And we'll also be really interested to hear from you, to understand your feedback and answer any questions that you might have in relation to the vaccine rollout for residential aged care. Thank you.
Thank you, Lisa. As I mentioned earlier, we received a lot of questions from you when you registered for today's meeting, so we're going to go through them right now. Now, I've split the questions into the following categories: vaccine rollout update, consent, staffing, wellness, and advocacy and rights. Many of the questions that you submitted were very, very similar. So you may hear your question asked just slightly different to how you worded it. Let's start with questions regarding the vaccine rollout. Michael, the first one is for you. It's from Stella. Stella has asked, if someone was given AstraZeneca for the first dose, can they be given Pfizer for the second dose to speed up the process?
Thanks, Stella. It's a really, really important question. The advice that we have on vaccinations in Australia comes from the Australian Technical Advisory Group on Immunisation. You may have heard them referred to as ATAGI. And this is the group of experts in vaccination, the top people in Australia who come together and provide advice to the Australian government and to the National Cabinet, where the state and territory governments are sitting as well, about what should happen with all aspects of our vaccine program here in Australia. The recommendation from ATAGI is that if you receive a first dose of a particular vaccine, the second dose should be of the same vaccine. So if you get the Pfizer vaccine first dose, the second dose should be Pfizer. If you get the AstraZeneca vaccine first, the second dose should be AstraZeneca. So that's the current recommendation. You may be confused because there are reports in the media about research being conducted overseas looking at whether it is possible to mix and match different vaccines. Now, that is research that's been carried out overseas, and the ATAGI group looks at that research. They meet at least every week, often more often, and if there are any changes to Australia's vaccine rollout, we will let the public know. But at the moment, it's the same dose of the same vaccine.
Thank you, Michael. Lisa, we had a question from Shannon. Shannon has asked, for residents that have only recently gone into aged care and they missed their first dose of the vaccine, how can they get a catch-up dose?
Thanks very much, Shannon. That's a great question. So we know that there are people that are moving into aged care all the time. And there might be instances where it's somebody new that's come into a facility, or perhaps a resident at the facility that for some reason didn't receive their vaccine when the Commonwealth's vaccine team came through. And that might be because they were unwell on the day, or perhaps absent. So there's a number of different things that we're able to offer. At the moment, in recognition of the situation in Victoria, we've set up some additional 50 vaccine teams, and we're calling them roving teams. And what we're doing is going around to all of the residential aged care facilities. At the moment, we're prioritising those that are in Tier 1 sites, so sites that have been areas that have been identified by the Victorian government as areas of concern. And we're going back to those facilities to offer all the residents and any staff that might not have received a vaccine so far the opportunity to have a vaccine. So for those people that aren't in a residential aged care facility, that is part of that prioritised program at the moment. And I should say we're adjusting that all the time. So as we get new information from Victorian, we're adding different residential aged care facilities to that list. The other options for people are to receive an AstraZeneca vaccine, and they can receive that through their general practice. So for people that are mobile and able to go out and see their doctor, to be able to get it from their GP, or visiting one of the Commonwealth or state vaccination clinics. Alternatively, GPs are able to come into the facility and offer vaccine to residents. What we'd really like to encourage is that for people that are new entrants, so people that are thinking about going into aged care, great idea to get your vaccine from your GP before you enter aged care. Thank you.
Thanks, Lisa. Michael, we had a lot of questions on a similar theme. I'll just put two of them together to give you an example. How do you prove that you've been vaccinated, and will we receive a record of completion of the 2 doses of the vaccine?
Yes, thank you. So very important issues. So when you receive a dose of the COVID-19 vaccine, the person who gives you the vaccine is required to enter your details into what's called the Australian Immunisation Register, or AIR for short. And every person in Australia who receives a vaccine has an entry on the Australian Immunisation Register. And you can get access to the Australian Immunisation Register in a number of ways. The details of your vaccine history on the Australian Immunisation Register automatically go to your My Health record. So if you have an electronic My Health record, and 90% of people in Australia have one, your vaccine details are there. You can also have the details downloaded if you have a smartphone onto your smartphone using the Medicare app. So there's an app for Medicare. If you download that and open it up, you can link that to your Australian Immunisation Register, and you can carry around on your phone the details showing that you've been vaccinated against COVID-19, both the first dose and the second dose.
Thank you, Michael. We're going to be putting links to all these resources that we talk about in the Q&A box if you would like to find them there. Lisa, how can someone go about finding out when their family members will be eligible for vaccination?
Thanks very much, Kyle. So the best thing that people can do is to go and have a look at the COVID-19 vaccine eligibility checker. And if you go to www.vaccinated.gov.au, checker.health.gov.au. You can find it there. And when you go onto the checker, you'll be invited to put in a description of who you are in terms of ask for things about your age and so on. And it'll tell you when you're eligible to receive the vaccine, and also take you to the clinic finder, which helps you identify where the vaccine is going to be available to you locally.
Thanks, Lisa. And once again, we will put links in the Q&A box for that as well. Michael, this was a bit of a specific question, but where can we access information about the effects of COVID vaccinations with other medications, for example, depot psychiatric medications?
Yes, so there's lots of information about the vaccines on the Australian Government Department of Health website, health.gov.au. Again, I'm sure we'll be putting that into the chat, health.gov.au. There's a search function, and you can search and find information about the different vaccines. Where there are what we call contraindications, where there is a problem with using a particular medicine, that advice again comes from the ATAGI, the Australian Technical Advisory Group on Immunisation, and those details are published on health.gov.au. If you have any doubts about whether it's okay to receive the vaccine because of an existing health condition, or because of any medications that you're taking, or because you've had another vaccination for something else recently, please talk to your trusted healthcare provider, talk to your GP, talk to whoever you trust for your healthcare advice about getting the vaccine. Lots of people have been making appointments to talk to their GP about getting the vaccine and getting advice there.
Thanks, Michael. While I've got you, I've got a question from Valerie that was sent through. If family members are fully COVID-19 vaccinated, why are they still not allowed to visit their loved ones during the lockdown periods?
Yes, it's another really important question, Valerie. So what do we know about these COVID-19 vaccines? We know that they are very good at providing protection against severe disease and against the risk of dying from COVID-19. However, some people who are vaccinated may still be able to be infected with COVID-19 if they come in contact with another person with COVID-19. And some people, even though they've been vaccinated, may still be able to transmit COVID-19 to other people. So your risk of being able to be infected or being able to pass the virus on to somebody else is significantly reduced if you've been vaccinated, but it's not reduced down to zero. And what this means is that you may still be at risk of transmitting COVID-19 to somebody else. Now, what we also know is that some people, even though they're vaccinated, they may not get a very strong protection against COVID-19. And this particularly applies to some people who are very frail and elderly, and to some people who maybe have a compromised immune system. So it's very important. That's why it's so important that everybody is getting vaccinated, because by having everybody vaccinated in our society, we are all protecting each other. And we are making sure that if somebody hasn't got as good a level of protection, they're being protected by everybody having been vaccinated. But that's the reason why, I hope I've explained that well enough, that's the reason why, even though you may have been vaccinated, there are still restrictions during times when we have community transmission occurring of COVID-19, still restrictions to people getting access to residential aged care. And may I just say, I know how distressing that is. I was due to spend last weekend with my mum when we were both looking forward to it. And of course, that was not able to happen because of the outbreak in Victoria and the restrictions that are in place to protect my mum and all the other residents at her aged care facility in Melbourne.
Thank you, Michael. Actually, Michael, I have a question from Eileen, who's looking for some advice for her situation. My father had one dose of Pfizer earlier this year, but unfortunately then went to hospital for a week. Whilst in hospital, he missed out on his second dose. I did let the doctors and nursing staff know, but they were unable to help. When he returned to the facility, he saw a doctor and they advised that it was now too late to have the second vaccine and he couldn't start the AstraZeneca. What happens now?
Yes, so thank you, Eileen. There are, of course, people who are going to miss out on their first or their second dose of vaccine because they were unwell on the day when Lisa's teams turned up, or they were away somewhere else. They may have been in hospital elsewhere for another reason, or there may have been some reason that they weren't able to provide consent at that time. And then when the team comes the second time to give the vaccines, again, there may be people who are unwell and unable to be vaccinated, or maybe in hospital or away from the facility. So it's very important to talk with the facility, and your aged care facility will reach out and talk to the members of Lisa's team about what happens with those people who've missed out on a dose. Now, unfortunately, if the time, it's supposed to be 3 weeks between the two vaccines, there is a little bit of leeway there. So you can still give someone the second dose a week or so after it's due. But the longer you wait, the less likely somebody is to generate a strong immune response, which is going to be long-lasting. And that's what we want. We want people to have a strong immune response, and we want that immune response to last for as long as possible. So it may be, if it's been quite some weeks since your dad had his first dose, it may be that we need to start again with his vaccine program, and either with whatever of the two vaccines is going to be available.
Thank you, Michael. Lisa, we received many questions many similar questions to the one that I'm about to pose to you. Where is the vaccination rollout in aged care up to in Victoria, and which vaccines are being administered in aged care and to workers?
Sure, thank you very much. So where we're up to in Victoria, we're actually in a really good place, which is very pleasing. So there are 596 residential aged care facilities under the Commonwealth's vaccine program for aged care. And I'm really happy to tell you that every single one of those has had a first dose visit. So when we talk about the vaccine rollout, we talk about first dose visits and second dose visits. Because as we know, ideally people are getting 2 doses of the vaccine with that interval in between that Michael's explained. So all of those 596 have had their first dose visit. Of that group, there's 414 that have had their second dose clinic, and the remaining facilities are scheduled for completion, I would say, probably over the next 3 weeks or so. So as Michael has explained, the optimum time frame between doses is around 3 weeks, and that's what we try and organise in terms of the timing for those clinics to return. So that's what the coverage looks like right now, and the time frame. In terms of which vaccine, we have been using the Pfizer vaccine in all of our in-reach teams to residential aged care. So staff who are, so all the residents receive Pfizer. Staff who might receive a dose through our in-reach clinic. So what we do is residents are our top priority because we know that they're the most vulnerable in our community. So when we go to a residential aged care facility and run a clinic, if we've got, once all the residents who would like to receive a vaccine have received it, if we've got excess doses with us, we will provide those to staff. So staff who are getting a dose through our in-reach clinic will get Pfizer. There are a range of different channels though for staff to receive the vaccine, and if they are receiving vaccine in a way that's not through our in-reach team, then they will be getting Pfizer if they're 50 years. If they're under 50 years, and they'll be getting AstraZeneca if they're 50 years and over. Sorry, I'm a little bit croaky.
Thank you very much, Lisa. Michael, once again, this question came through many, many times. Will it be compulsory for all visitors to have a COVID vaccination to visit an aged care home like it currently is with the flu? vaccination?
Thanks, Kyle. So at the moment, it's not compulsory for all visitors to have had a COVID-19 vaccine before visiting an aged care home. At the moment, of course, not everybody can get access to a vaccine. As we roll out the vaccine program, at the moment, we're rolling out by age groups. In Victoria, you can now get a vaccine if you're aged 40 years and above. But if you're aged under 40, you can't yet get a vaccine. So we can't bring in requirements until everybody has had the opportunity to be vaccinated. But it is something that we're looking at very closely through the Australian Health Protection Principal Committee, the AHPPC, which I sit on with our Chief Medical Officer, Professor Kelly, and the Chief Health Officers of all the states and territories, including Professor Brett Sutton. So we are looking regularly at this issue of, do we require people to have vaccines in certain situations, and we're providing ongoing advice to the National Cabinet, the Prime Minister and the Premiers about this as time goes on. But at the moment, it's not compulsory. Doesn't mean it's not going to be compulsory in the future. So the message is, when it's your turn to get a vaccine, please get vaccinated. You're protecting your own health and well-being. You're also protecting your loved ones, including your loved ones in aged care.
Thank you, Michael. Lisa, a question came through stating, in terms of vaccination, it seems a lot of attention is given to the population in capital cities, while many rural towns and communities have limited access to the vaccine. My GP receives 50 doses a week in a town with a population of 8,000. It'll take 3 years to get everyone done. What's being done?
Okay, that's a great question. We want to make sure, obviously, that everybody in Australia gets access to the vaccine and is able to have the vaccine if they choose to do so. So we're working really hard with a range of different organisations that are providing vaccine in rural and remote areas of Australia, as well as in our cities. So the organisations that are able to provide a vaccine include Aboriginal community-controlled health services, GPs, so we have many general practices, and I'll talk a little bit more about that in a moment. We've got state and territory government clinics, and we've got what we call Commonwealth vaccination centres. And we've got those spread, those different channels that I've just mentioned really spread around all of Australia. In terms of GPs, at the moment we've got, I should just track back and say, in terms of those sites that I just mentioned, which we call primary care sites, we've got 4,600 of those at the moment around Australia, and they're growing. So around 1,500 of those 4,600 are in rural and remote areas around Australia. We know that for many people, where they want to go to receive their vaccine is from their GP, which makes great sense. Your GP is the person that you know and trust and knows you and knows your health. So on the 5th of May, the government increased their allocation to around almost 4,000 of those GPs. So what we're doing is, as more vaccine becomes available, we're making sure that we push it out and make it available for people to give. So we tripled the allocation to almost all of those practices on the 5th of May. And then again, on the 24th of May, we were able to increase the allocation again to around 1,300 of our general practices and our Commonwealth vaccine clinics. The other thing that we've done is we've opened now the process that we put in place to identify which GPs can provide the vaccine to their patients. We do that through what we call an expression of interest process, and we've just opened up another one of those. So we're looking for another 900 GPs around Australia that can participate in the vaccine rollout, and we're envisaging that the extra 900 should come online from mid-June. We're working really hard to together really closely with our state and territory colleagues, because they've also got vaccine channels through the state and territory clinics. So we're working together really closely to make sure that we've got a really clear picture of where all the access points are around Australia, to identify where we think that there might be any gaps, and to make sure that we've got really comprehensive coverage across all of our different communities. So I would really encourage people, if you can't find something that's local or suitable to you right now, please keep checking that eligibility checker that we mentioned earlier, because as new sites come online, and they're coming online all the time, you'll be able to find them.
Thank you, Lisa, and thank you, Michael, as well, for answering those questions on the vaccine rollout section. Look, we have received quite a few questions related to staffing. Many of them were exactly the same. So, Michael, I'll give you the first one. This one's from David, but we got the question many times. Are staff still allowed to work across different facilities? And once Victoria comes out of lockdown and restrictions ease, will staff be able to then once again work across various facilities? And if so, why?
Yes, thank you. Thank you to everybody for asking the question. So at the moment, Victoria and Melbourne is a hotspot for COVID-19, and that's a formal definition by the Australian government. And as part of being a hotspot, that means that people are not allowed to work across facilities. You're only allowed to work in a single facility. And the reason for this is obvious. It's to prevent the risk of someone who may be infected with COVID-19, whether they have symptoms or they're asymptomatic, but still able to infect other people, to prevent people from moving from facility to facility and being at risk of infecting people. When we have no community transmission, the hotspot definition is lifted, and in effect we return back to normal, and people then being able to work in different sites. Now, when we have no community transmission, there is no risk of people transmitting COVID-19 between sites. But when we do have transmission, this measure comes in play. Some facilities will bring in this requirement even earlier than the Commonwealth does with its declaration of a hotspot, or the state does with its determination to move into lockdown. All facilities, residential aged care facilities, have their own plan on how to prevent outbreaks of COVID-19, how to protect their residents and staff, and how to respond if an outbreak does occur. And so each facility has in place its measures to protect its residents and its staff. So you may see things being slightly different from one facility to another, depending on their local assessments.
Thank you, Michael. Another staffing question for you. My sister-in-law and I are nurses. If you work with vulnerable patients in areas such as cancer, the flu vaccine is mandatory, or staff are obliged to be relocated. How come this hasn't happened with aged care and COVID vaccinations?
Yes, so COVID vaccinations, obviously we are strongly encouraging everybody to be vaccinated against COVID-19, and we are doing all we can to facilitate people being able to get access to the vaccine when it is their turn under the prioritisation steps that have been outlined. So since the start of the rollout, phase 1A, the people who were in the top priority are the residents and the staff of residential aged care facilities. These are the people who've been able to get access to vaccines right from the very start of the vaccine rollout. The National Cabinet has asked the Australian Health Protection Principal Committee to provide regular advice about if and when we should be mandating COVID-19 vaccines for particular groups in Australia, which includes the people working in aged care, people working in other healthcare settings, people working in quarantine facilities, and others. So there is a continuing review of what's happening with vaccine rates across the country, with ensuring everybody is able to access vaccines. We still have some challenges with people in some rural areas and some remote areas being able to get access to vaccines. including the Pfizer vaccine, which has more complex refrigeration requirements, making it more difficult to transport out to those areas. Lisa and her team are doing amazing work working to overcome those logistics. We have the Royal Flying Doctor Service currently flying out to very remote communities across Australia, vaccinating the entire community, including people who are very elderly in aged care in those communities. So we will be progressively providing that protection to everybody in Australia. And as I say, we are continuing to review when and if mandatory requirements come into place.
Thank you, Michael. It's really important that you all continue to look after your mental well-being during these times. And we received some really important questions on this topic, so we're going to have a look at those now. Deb, can I give you this question? It came in from Andrea. How do aged care facilities ensure that their residents' emotional needs are met during lockdowns, particularly those residents with dementia?
Very good question, and one that we hear on a daily basis. Outside of lockdown, but particularly when people are in lockdown. Look, the enhanced visitor restrictions, which came into play really on the 28th of May, have some specified purposes for people to visit, and they are to support physical and emotional wellbeing of the residents. So we would certainly be advocating for those visits to continue for that purpose, particularly for those people in residential care who have dementia. And it is the provider's responsibility to ensure that they are taking care of everyone's not only clinical needs, but their psychological and emotional well-being as well. So that is a standard thing that they must always be considering. And in this, exceptional circumstance, important that those visits continue, as I say, and that they have other measures in place that involve participation by staff in the care and services provided to those people. You're very welcome, if you feel that this is not happening for your loved one, to contact us, and an advocate will certainly get involved.
Thanks, Deb. And that number is 1800 700 600, and you'll talk to an advocacy support person who is based in Victoria. Thank you. Craig, what supports are available for residents and their families who are suffering from social isolation caused by the latest lockdowns in Victoria?
Yeah, so Kyle, I'd just reiterate as well that, and providers need to be looking, that there's been some comments in the chat there around the adequacy of the staffing numbers, and providers have an obligation to make sure that the staffing numbers are adequate, particularly when there's the need to support people who might be more isolated during that. So the provider themselves needs to make sure that there's the lifestyles people there are engaging with people. There are also telephone support lines. There's a grief and bereavement service, which just is a really good, I suppose, support there to talk about what is happening for someone who might be in a residential facility at the moment and not able to walk around or exercise and those sorts of things. Providers should be also looking at ways that they can keep people engaged, be that via virtual visits, window visits, those sorts of things. So it is absolutely important that and vital that we make sure that older people who are living in a residential facility can still connect with family, can still know what's going on, can ask their questions to us directly. And it is a challenge sometimes to get through to actually allow people to ask the questions they're looking for. But if someone is struggling, Beyond Blue, Australian Centre of Grief and Bereavement, our advocates are here as well, as Deb was talking about.
Thank you, Craig. And we will put the contact numbers for those networks that Craig just mentioned into the Q&A chat for you. Michael, I've got a question that came through from Loris. The question is, aged care staff are the backbone of all care for our loved ones. How are staff being looked after during this pandemic, especially around vaccination, rostering paid leave if they're needing to isolate or to take sick leave?
Yes, thank you, Loris. It's absolutely essential that we are respecting and looking after and valuing the aged care staff, the people who are caring for our loved ones. And I know that the people at the facility where my mum is, they are really grateful when family members reach out and just say thank you for all that you're doing to protect our family members at this time. It's also really important, of course, that the people who are running the facilities are doing all they can to look after the well-being of their staff, the people who they employ, and there's a lot of work underway on how can we support people and make sure that they feel valued at this time. There are also a number of initiatives in place now. Initiatives like the single site payments from the Commonwealth come into play when the hotspot declaration is declared, and then those benefits are available to people who previously were working across sites to allow them to work in the one site. So lots of different people who should be providing lots of care for the people who are looking after our loved ones.
Thanks, Michael. And can I just say on behalf of all of the staff from OPAN and all of the staff at ERA, thank you so much to all of the aged care staff out there for the incredible job that you do, not just day to day, but specifically through this very, very trying time. We know how difficult it is on you and also on your families as well. So thank you. We can't tell you how much it is appreciated. Michael, can I give you a question from Nick? What physical fitness programs are being put into place to help stimulate residents both mentally and physically while they're in lockdown?
Yes, this is incredibly important, and especially for residents in Melbourne and across other parts of Victoria, because of course this is now the fourth period of lockdown for our loved ones in residential aged care in Melbourne. And the Australian government has recognised that it's important that people's physical and mental and emotional well-being is looked after, not just during the period of lockdown, but also after the lockdown ends, to help people to recover from any challenges that may have arisen while they've been in lockdown, for any deterioration that can occur in some people when they haven't been able to carry out their normal daily activities. So there is funding support available to aged care facilities for bringing in physical therapists, for having support for mental health and well-being of residents, as well for group therapy. For the residents coming together as a group once the lockdowns are over to try and assist people to regain their any loss that may have been experienced in their mobility, in their feeling of emotional well-being as well. It is a really important issue. The lockdown periods are very hard. They're hard for us as family members, but they're particularly hard for the residents. People being locked in their rooms for extended periods of time, not able to interact with other people, is really, really challenging.
Yeah, Kyle, I'll just add to that. When we did the meeting on Monday night with ARCare, one of the things that was really impressive is that they had thought that through, and they had also looked at that this sort of deterioration could happen really quickly. And so they'd already instigated I suppose some additional assessments and checks to monitor people that if this might be coming. If people though feel that this is happening and that the person they're connecting with when you check in that might be an issue for them, for your loved one, make sure you let the facility know and let them know of your concerns. And if it's sort of not getting through, please give us a call on 1800 700 600 and we'll get an advocate to help with that discussion as well, because the physical impact here can be significant. But there are some providers out there doing some really great stuff, like ARCare was told us about on Monday night. Thanks.
Thank you, Craig. Thank you, Michael. We received many questions about consent, so we're going to have a look at those now. Lisa, many questions on this same topic. I'd like to ask about the procedures around consent for vaccines. How is it given and how is it recorded?
Sure, thank you. Look, it's a great question. And I will start off by saying that while we really encourage everyone to get a COVID vaccine, it's important to recognise that all individuals do have a choice. And it's important to understand that if somebody makes a decision, you know, if your loved one made a decision that they didn't want to get vaccinated, then it's not going to affect their right to access to safe, quality residential aged care. And the Charter of Aged Care Rights really supports older people in making their decisions around their care. So just want to make that really clear. Prior to giving a vaccine, so when our vaccine teams go out, they need to make sure that they can confirm that a valid consent has been given. And so they'll be given either, so our vaccine teams who go out, and they're the people that actually give the jab, they'll be given the residents' consent form to have a look at, or they will be able to see in the residents' care notes that it's been recorded that the resident has affirmed that they want to receive the vaccine, and they'll check that with them again verbally. So residential aged care facilities are responsible for organising consent ahead of the vaccine team going out there, and we do that for a couple of reasons. Firstly, because this can be a complex decision for some people, so we want to make sure that there's appropriate time for family members who want to have a discussion about that. People may wish to consult their GP or other clinician about that. We also know that there will be people in residential aged care where family members or guardians need to be involved in making the decision. So what we encourage is that all of our residential aged care facilities have these conversations with their residents as soon as they can, to make sure that people have had time to have those conversations. Really important to say too that even if we have a resident at a facility that does have some level of cognitive decline, we would still really encourage that person to be included in the conversation and for their wishes and preferences to be taken into account. So the thing to be clear about is that the vaccine doesn't have to be prescribed by your GP, so you don't need to get a consent necessarily from a GP. It's about the personal decision of the person receiving the vaccine, and where that person has others with supported decision making, then the decision rests with them. There's a whole bunch of really good material on our website if you're wondering about the sorts of things that you might want to explore in having a conversation about consent, and the sorts of questions that you could be asking or issues that you might want to consider. There's some really good content, once again, at health.gov.au that will help you think about the sorts of issues that you might want to explore. So that's all there. What I would say is that in terms of consent forms, the Department of Health has a consent form on our website, but residential aged care facilities don't have to use that if they don't want to. They might have their own consent forms. For people who are under guardianship arrangements, there might be particular consent forms which are required in their jurisdiction. That's all fine. It's very flexible. It's also okay to provide a verbal consent. So people don't necessarily have to sign a form. It's as long as there's been a conversation and it's clear that the resident or the supported decision maker has had the opportunity to understand the risks and benefits of receiving the vaccine and that they've made a choice, then that can just be recorded in the resident's care notes. Thank you.
Thank you for that, Lisa. And I've just seen in the Q&A chat box, they have put the direct link that you can go to get the consent information and the forms that Lisa was talking about. And it's also available in languages other than English as well. Thank you, Lisa. Jared, I've got a question for you from Wanda. What can be done about residents who are currently in aged care facilities whose families are anti-vaccination and hold the medical power of attorney and won't give their consent for the vaccination?
Thanks very much, Kyle. Part of that answer's already been given by Lisa at a high level. So firstly, we start on the assumption that we know that the vaccine decision is a voluntary decision. And then we have to acknowledge that wherever possible, that decision is going to be made by an older person. That is the person who has decision-making capacity. Now, where somebody is a has the medical treatment decision-making authority, I'd point them to the Office of the Public Advocate website. There is some really important guidance notes for those people. And if I could just read a couple of those statements just to give some insights to that. So it starts off saying, if a person has decision-making capacity, they can consent to or refuse COVID-19. The vaccine. If they don't have capacity and there's no advanced care directive, their medical treatment decision maker can consent to or refuse the vaccine. But it's then that a whole series of guidance notes exist for those people to make sure that the consent is done on behalf of the wishes of that individual. So the question isn't a question of what the family think about vaccination. The question for the medical treatment decision maker are what are the wishes of that individual person. And so I'd point people to the Office of the Public Advocate website. And there's also a phone number, Kyle, that medical treatment decision makers can ring if they would like some further advice from the Office of the Public Advocate about how they discharge that responsibility on behalf of the person that they're exercising that power for.
Thank you, Jared. Lisa, can I just pick up on a question that's come through? It says, my dad's in aged care, was supposed to be vaccinated this week, but when the team of vaccinators who he'd never met before rolled up to his home, he has mild dementia, he and a few other residents were so confused that they refused then to be vaccinated.
Yeah, look, thank you. That's a great question, and we know that happens, and it can be, confusing and frightening for people where we've got people coming into the facility that they don't know, and things happening around them that are unfamiliar. We also know that there'll be other cases where people change their mind about the vaccine, or where they might have missed out for another reason. They might, have been unwell on the day, or perhaps absent in hospital. So at the moment in Victoria, what we've currently got are 50 what we call roving teams, and these are teams that are doing what I would describe as a sweep back across residential aged care facilities, because we don't want anyone to miss out. That's the message. So at the moment, those teams are prioritising those facilities that are in areas that the Victorian health authorities tell us are the areas most at risk. So that's how we're prioritising those teams. If you're wondering about whether or not the facility where you might have a loved one is on the list, ask the RACF. They may know, but be patient with them if they don't know. It's a movable feast, so that list is changing all the time, and we're doing the very best we can to get around to everybody. So we've got those teams in place. That we're growing the number of teams, and we will do our very best to get back to make sure people don't miss out. The other option for residents, as I mentioned before, GPs who would often be visiting within the facility are able to come in and provide a dose of vaccine. So GPs are currently administering AstraZeneca, so they can come in and provide the vaccine, which is a really great option. The other option would be that if people are in good health and they're able to leave the facility, they can go out to their GP or visit one of the state or territory vaccine clinics and so on. But the message that I want to leave you with is that we understand how important it is that all of our residents receive the vaccine, and we're doing our best to make sure that we put those arrangements in place.
Thank you, Lisa. You've just answered this one, but I'll get you to clarify. What happens if someone didn't provide consent when the vaccinations were being done, and now they've decided they want to do it? Will that happen when, as you said, the sweep teams come back in to do the second?
Yeah, that's right. So there will always be an opportunity. So the directions that we're giving our VAS teams is that when you go back to a Victorian clinic, and also when we go back to do second doses. So we've got our roving teams who are making sort of what we call special roving visits, but we've also got teams that are going back to do second doses. And when we go back to do a second dose, if there are residents there who have decided that they would like a first dose, that's something we can do. But in order to do that, we have to know in advance so we can make sure that there's enough vaccine going out with the team. So it's really important that if the people, if your family and friends are making decisions about what they want in relation to vaccine, that the facility knows that. So it'd be really important, it'd be incredibly helpful if you can make sure that that's conveyed to the facility manager so that they're aware that that person wishes to receive a vaccine. So that information can then flow through to us and we can make sure that that's taken into account.
Thank you, Lisa. Now, we touched on this also, but I think it's really a real important point that we clarify. In regard to consent, what is being done for residents and families who speak languages other than English?
Yeah, so look, that's a great question. We've got a lot of information on our website and much of it is in many different languages. So if you're not sure, please go to the website. We've got content including fact sheets and videos in 64 different languages. The other thing that we can do is people can call our COVID hotline, 1800 2080, and non-English speakers can access telephone interpreters through that service. You can also, so if you're looking for an interpreter service, you can call the number that I just mentioned, but you can also call 131 450 and use that, and they'll help you have a conversation with the COVID hotline. The other thing that I'd really encourage, and that we've seen has worked really well in facilities, is where family members or friends or other people from the community who have good English skills are able to come in and facilitate those conversations. That can be really helpful. And we do really encourage, we know that it can be really important for residents to be supported through their vaccine experience. And the RACFs that we work with have been really great about encouraging family members or friends to come in and support residents through a vaccine clinic. And that can be particularly important for people that don't speak English.
Thank you, Lisa. And we have put some information into the Q&A box on that as well. Lisa, I've just pulled out one of the live Q&A questions that came through because it's what we're talking about right now. It's from Eileen. What makes a location prioritised for access to roving team visits? How would a family member or resident know if their facility will have access to this? Yeah,
that's a really good question, Eileen. So the Victorian health authorities are identifying what they call Tier 1 areas of concern. And I'm pretty sure, I would need to check, but my assumption would be that those are identified on the Victorian Health website. And then what happens is we have a look at those areas and then identify the facilities that fall within. But if you're not sure, the best thing to do is to contact your facility, and they have details of our team, and they can give us a call and we can provide that advice.
Thank you, Lisa. Let's talk now about advocacy and rights in regard to the questions that you have pre-submitted. Deb, this one's from Fiona. During this lockdown, I was advised I could not visit my mother. Mum has Alzheimer's, so cannot communicate other than face-to-face. How am I able to keep visiting her without having an argument every time and advising them that I have spoken to Mum's elder right advocate? How do you make aged care facilities be responsible under their duty of care for those without a voice?
Yes, thank you for that question. And it is a very good one and very pertinent, and one that we, again, deal with every day and have been through this lockdown and previous. If you've spoken with an advocate and they've given you advice with regard to the specified purpose for visiting, and you have been able to gain access to your loved one, that's great. But if you have to keep arguing that access, then that's not good. It means it hasn't been handed over at the change of every shift, and we need to make sure that happens. It means it hasn't been exceptionally reported within Mum's care plan that you will be visiting for the purposes of providing her with support. And so if you would like to, and you're very welcome to, contact us again, an advocate can then represent you to the facility and make sure that those added measures are in place. because you certainly shouldn't have to be constantly arguing for that access. So please get in touch with us. Absolutely, you should be able to get in to see your loved one, and they have a right to that. Well, I wanted to say unrestricted access, but of course we are in an environment where access is restricted.
And so one of the things, Kyle, that we're doing as well, and Gerard and I are talking around this as well, is there are tiers on the restrictions, and there's Commonwealth guidance. Sometimes that gets interpreted slightly differently at different facilities, but we're working and talking constantly about what are the proportionate restrictions that needed, and as things hopefully over the next coming days start to settle down to where the level of visitation restriction is there. And so we'll continue to advocate on behalf of people around a proportionate approach to those visitation restrictions, and keep talking to people where they feel that that's not being respected, and that the what's called the public health orders aren't being followed there.
Yeah, thanks, Craig, and yeah, same here. We will keep working with providers on that level as well. Here in Victoria, as you probably all know, we haven't really gone back to unrestricted access across the board. There have always been, and it depends on the site and the facility and numbers and a whole lot of other factors that influence their ability for visitors to move freely within the site. So in some sites, we still have had restricted access prior to this lockdown. But of course, our advocates will work with you and your loved ones and in your particular individual circumstance to make sure that you do have access.
Thank you very much, Deb. Gerard, I've got a question for you from Paula. During a lockdown, as is currently happening, why do residents not have the right to leave the facility and follow the rules that the public are to follow?
Thanks, Kyle. This is a really important question. It sort of starts with what Michael was saying earlier on, that the whole purpose of our situation at the moment is to provide protection for some of the most vulnerable people in our community, and they are often living in residential aged care. And so just as we regularly see in the media the public health orders that affect the way each of us live in our own home and our own community, and how they change and evolve over time as the circumstances change, there are specific orders and directions that apply to residential aged care providers. And they are set by the public health team and informed to every provider, and they do evolve and change over time. And so if people are concerned or query about where things are up to at a particular point of time, a really important starting point is with individual providers to clarify what are the circumstances for visits and that apply for residential aged care at that particular point of time. And I'd go back to what Deborah was just saying. If people believe that the particular needs of their loved one are at a point where they think a visit or is particularly important, then they can always contact Elder Rights Advocacy and seek advice about whether there are particular circumstances that an advocate can take up on their behalf. But it really starts with the fact that there are particular public health orders that do apply to residential aged care services here in Victoria at the current stage.
Thanks, Gerard. Deb, this is on a very similar theme. If a facility faces an outbreak and mum is on respite, is it possible for the family to take their mother out of the facility during the outbreak, considering the facility would be locked down?
I would think yes on that, but of course, again, public health will have an issue with regard to quarantine for that older person if they have been at an exposure site, and if that facility is considered to be that, the person may need to quarantine within the home, and indeed other family members may need to do that also. That would certainly be something to check with public health, but of course people can leave, and there will be certain restrictions placed on that.
Thanks, Deb. Craig, how are those residents who cannot advocate for themselves, for example, they're living with dementia, they've had a stroke, cognitive impairment, how are they being communicated with during a facility lockdown, and who is in touch with their families? Are there guidelines in place to ensure that this is achieved?
Yeah, this is particularly challenging when there's no visitation and family members who are often what we see as partners in that care provision and that support provision. And those people should be allowed to go in under really tight controls and good infection prevention controls. Those people should be allowed to reconnect with the person, because it's often the non-verbal cues. The staff and the lifestyles people are extremely important during that time as well. So they will need to be making sure that they are getting in and working for that person. As soon as we can get back in, we will be also the advocates in ERA and from across the country will be going and making sure discussions continue to happen, particularly with people who need to communicate in a non-verbal manner as well, and see how they're going. Again, if people are concerned, give us a call. We'll help negotiate, particularly for people with dementia that need that person who is normally the regular person coming in, maybe helping feeding or providing that social and emotional support as well.
Thanks, Craig. Deb, a question from Sally. She's very concerned about the health and well-being of her father in the event that the residents are confined to their rooms. He has dementia, low vision, needs help eating, drinking, and fully dependent for toileting and all care. He needs 2 staff members and a hoist to get between the wheelchair, the toilet and the bed. He's unable to use the call bell because of his dementia and his blindness. What can we do to try and ensure that he doesn't suffer physical harm and distress if he's isolated in his room? What level of increased staffing should be put in place for care of residents confined to their rooms?
Good, very, very good question. What level of enhanced staffing? Indeed, we know we've got a shortage of staff, so we're probably not going to see an increase in staff, and that is a huge concern. For residents isolated in their rooms, and many, again, here in Victoria, regardless of the current lockdown requirements, have been isolated in their rooms, either fearful of coming out of their room if they're able to, and also not being able to see people without a mask on. A resident said to me the other day they haven't seen a human face without a mask. They can assume people are smiling because of their eyes, but they've not been able to see it for well over 18 months. So huge, huge concern. But again, we do have these enhanced visitor restrictions, but they do allow for visitors. So in your dad's situation, given all of the issues that he's facing, he most certainly would be eligible for visits. So if the provider is not allowing those visits for whatever reason, I would encourage you strongly to contact us, and an advocate will become involved on whatever level you're comfortable with that involvement. But you should certainly, under the current restrictions, be able to get in to visit with your dad face to face, with a mask, of course.
Thanks, Deb. Look, I've just had a live question come through, which I think we need to answer now. It's come in from Simone. I want to bring my father out of aged care to live at home, and this is his greatest wish. However, to enable this, I need to make modifications, widen doorways, add rails, etc. As he is not currently living at home, we're unable to access the home care package. Thus, we're caught in a vicious cycle. It's currently costing us $3,000 per month for him to be unhappy. How can I get help to modify the house to bring him home if the package is only available to people already living at home? Help with designing the modifications, financial assistance for the modifications. What advice would you have for Simone?
I might go for a first shot at this, and then Deb can correct me if I'm wrong. So we will check up on that, because during the previous outbreaks in Victoria, there was some services that are available to help people who did make that decision to transition home. We'll have to check whether those things are still available, given the emerging nature of that the issue there. But My Aged Care is probably the best place to contact. If you go to the My Aged Care website and talk to their contact centres, they have people there that do know about these services and about what's available to help for people who might be wanting to have a temporary support at home or move more permanently back into home again. So for first port of call, have a check of My Aged Care. We'll also put some information up on our website as well.
Thank you, Craig.
Sorry, Kyle, just further to that, yes, there may be emergency leave provisions that you can take advantage of and bring your loved one home, and some support services will go in place. But when it comes to home modifications, even if you are receiving a home care package, there are absolute limits to what those package funds can be used for with regard modifying the home. We are currently doing systemic advocacy on this very issue, but I would not be placing too much store in the fact of getting a home care package to modify the home to enable your dad to be able to come home safely.
Thank you, Deb, for that input. Deb, in the pre-registration questions that came through, there was a lot around this similar theme, but I'll give you this example. My mother is 94 years old from an Italian background. She's struggling to understand why she cannot go in and see her during the current lockdown. I would like to know why I cannot visit her to explain. She's had both doses of the vaccine. We live in an area that's never had a dose for over 15 months. I've Skyped her, but she doesn't understand, and I can see the distress it's causing her. What should I do?
But one of the specified purposes under the enhanced visitor restrictions that we're currently under is to be able to go in and visit with the person as an interpreter to provide language support. And I would advocate very strongly that in this situation that visit should be allowed and that you would be providing that sort of language support to your mother. Not only that, but also providing her with that emotional, social wellbeing support as well. So you could talk to the provider, of course, but contact us and we're very happy to help you with that situation.
That's great advice, Deb. Thank you. And Antonia, if you do need some help with that, call us on 1800 700 600. Deb, what time frame can people expect to be able to talk to a Victorian advocate? I keep giving the number out. Is triaging and support in place from other state and territory advocates?
It certainly can be in place with very quick notice if we do require it. All of the OPAN members came to our aid last time and have offered their support this time. Currently what we have are expert professional advocates on the line. So if you do call us, you won't get a call centre, you won't get someone to just take your details. You will get to speak with an intake advocate or a duty advocate. So people who are professional and specialised advocates can provide information and advice at that first contact. If you need further support through COVID, which is an emergency situation, that support will be provided to you within a 48-hour period. And indeed, if there's other support required, well, you will go on a wait list. At the moment, we hope to get back to people within a week with regard to any issues that should come in. But we are triaging and, it just depends upon the urgency of the matter. But certainly on first phone call, you will be able to speak to an advocate who can give you expert advice.
Thanks, Deb. For the remaining time, we're now going to look at the questions you sent through as part of our live Q&A, and thank you for sending them through. Craig, the first one is for you from Doreen. Why can't there be an isolated visiting room that can be cleaned after each visit?
Yeah, some facilities have actually done that, and they've been kind of a little bit like they're like the window visits, but some people had set up some quite innovative ways to do that. That is something that providers can do. Obviously, you still probably need to do the social distancing, the masks and gowns and those sorts of things. Probably the physical contact that we all want to be able to go and hug mum is going to be something that we need to wait a little bit longer for. But some of that could be a good idea for places to look into. A number of places are doing that.
Thanks, Craig. Michael, the next one's for you. It's just to reiterate what we've said. Jenny wants a clarification. What will be the rules regarding entry of unvaccinated family members into a facility? Will there be restrictions on them not being allowed in, keeping in mind the vaccine is voluntary?
Yes, so thanks, Kyle, and thanks, Jenny. As I mentioned earlier, this is still being determined, so things may change over time. So please just keep an eye on on health.gov.au, and I'm sure that OPAN and other organisations will be advising if and when rules change.
Thank you, Michael. While I've got you, from Rebecca, are staff being tested daily before they attend work, or how does that work?
Yes, so each facility has, right across Australia, has mechanisms in place to protect the residents and to protect the other staff. This may include questioning people before they go to work as to whether they've had any symptoms, whether people have been to any sites which are at risk of having contracted COVID-19, if people have travelled recently to other parts of the country where there have been outbreaks. There's temperature checks being used, and these are being used for visitors in many facilities as well. And there's regular testing being carried out by staff, particularly when we get outbreaks occurring, and different tests are being used in different parts of the country, whether it's the tests that we're used to with the nose and the throat swabs, or it's the saliva tests which are being used in some parts of the country as well. So it depends on where you are, and it also depends on local restrictions and requirements which are being put in place by the local government.
Thank you, Michael. Another one for you. This one's from Doreen. As an unpaid carer for my mother, can I be fast-tracked for a vaccine like paid carer staff? And is there a form, or how do I go about it?
Yes, so the issue about who's eligible when for the vaccine is on the vaccine eligibility checker. So if you go to the vaccine eligibility checker on health.gov.au and you enter your details, you'll come to different sites about the work that people are doing, the voluntary work people are doing, the caring work and so forth, and it will tell you whether you're eligible or not. Obviously, if you're aged 40 and above in Victoria, you're eligible for a vaccine already.
Thank you. I got a question from Deb. This is from Elizabeth. Can Skype be used more than once a week for interstate family?
Again, yes, I would want that to be the case, but it will rely upon the facility's staffing levels and their ability to be able to provide that sort of support to the resident. Depends whether your loved one in care can use that sort of technology without assistance, or whether they need support from staff to use that. Again, it's about speaking to the provider and trying to set up a schedule of making contact. And even though we would want that to be whenever it suits, it may be that you'll need to put some time frames around it just so that they can schedule it in if staff need to be able to assist with that.
Thanks, Deb. Craig, a question's come from Lauren. When all the residents are vaccinated and visitors are vaccinated, why can we not visit? My husband has high cognitive regression and can no longer communicate effectively, even by FaceTime. He does respond to me, his wife. However, he has been badly impacted when she can't visit.
So the visitations should be, it's something I think that needs to be looked at over time about what does the lay of the land when you get a whole community vaccinated, and where we have lots of people either in a residential facility with the staff, the residents and the family members are all there. We need to look at that and see where we go to from there. At the moment, I suppose it's challenging because we are still rolling out the vaccine, and to know that everyone's there, that the immunity levels are, like Michael's spoken about before. So, but visitation should still be able to be facilitated. So even if it's a window visit at the moment, and then as we sort of move out of lockdown, to look at those possibilities. So keep trying. As Deb said, give us a call.
Thanks, Craig. Deb, I'll put this one to you. It's from Kathy. I'm more concerned about the mental well-being of my dad when he is confined to his room and limited contact with his friends and family. Why is that during lockdown they rarely see or are able to breathe fresh air?
Oh. Well, indeed. And, of course, they should be... Residents have a right to be able to access the community. Now, that can't happen at the minute, but of course they should still be able to go outside of their room, breathe fresh air. Again, I suspect that this is impacted by the lack of staff We don't have the staffing levels that we need under normal circumstances. And under these circumstances, we certainly don't have enough to help facilitate these sorts of interactions for older people. Hence, they're locked down in their rooms, and for good reason, to stop the spread, of course. We certainly wouldn't argue with that. But if the site does not have sufficient staff to help facilitate these sorts of actions and contacts, then it's not happening. And that is, you know, at the core of these issues.
Thank you, Deb. Craig, can you tell us where we stand? If we feel our provider has been negligent in their duty of care by allowing staff to be unvaccinated?
Yeah, look, you say the unvaccinated staff, it is voluntary, the vaccination at the moment. So I'll just say that first of all. If there's other issues of concern around the quality of care or what's being provided, the advocacy services there, but also the Aged Care Quality and Safety Commission can take a complaint, and that would be at agedcarequality.gov.au and put in a complaint about what specific concerns that people have, and they will investigate that. Probably two paths is the Quality and Safety Commission and to us as well.
Thank you. We've got just two last questions to do. Michael, Rachel would like to know, what is the process to ensure that medical records are up to date within the aged care facility when the resident is given the COVID vaccine by a GP, vaccine given within the aged care facility?
Thanks, Rachel. So that it is a responsibility for the facility and, of course, for the treating GP to make sure that medical records are being updated. Of course, as I mentioned earlier, the details of the vaccination are also required to be entered onto the Australian Immunisation Register, the electronic record.
Thank you very much. Craig, what's the difference with aged care workers going in vaccinated as opposed to their family members that can calm them but aren't allowed to visit?
As we sort of said, there's still the need for people to be able to visit. We need to take the appropriate infection prevention control measures, which is masks, which is probably gloves and gowns in some places as well. Should be still be able to allowed, and yes, the visitation should be still able to occur. Can I just say as well, and we're about to finish up, is that there are a number of questions around some nuances of different types of vaccines being used and those sorts of things. We will have a look at your questions and whether there's additional answers we need to put up on a Q&A on our site if we haven't actually got to those questions. Thanks, Kyle.
Thank you, Craig. We are unfortunately out of time, but we want to thank you all for your participation today. We'd like to thank the speakers for joining us today and sharing with us their knowledge and their information. Please remember, if you'd like to speak to a Victorian advocate support person based in your state, you can call OPAN and ERA on 1800 700 600 between 8 a.m. to 8 p.m. Thank you, everybody. We wish you and your families well. Goodbye.